All right, what's up guys? Dr. Matt Symons, and I'm here today to talk to you about arthritis. It's one of the most common reasons that people come to see us here in the office. And we're getting really excellent results, not only with the chiropractic care, with some of the other therapies we've been doing. There's different types of arthritis that can affect the spine, but today I'm here to talk to you about treating one specific kind, osteoarthritis, also known as spondylosis. It's degenerative joint disease or degenerative disc disease. Osteoarthritis is a painful condition when it happens to the spine. Unfortunately, it's very, very common, even in people you think would be way too young to be affected. It's often related to both macro and micro trauma, which means big things and little things, like lifting, car accidents, you name it, but it also can happen just from bad ergonomics, whether that is carrying a backpack the wrong way, sitting at a desk and a computer, looking at your cell phone. Even the birth process itself can start that process. Crazy, right? The damage that's caused to your spine eventually leads to more and more degeneration of the discs, which is the cushion between your spine, and it can actually then lower the amount of space that affects the nerves that go to every part of your body. So if you put pressure on the joints in the wrong way, what happens when you have that misalignment of the spine is instead of having a good, let's say, good curve in your neck or in your low back, if that curve is lost, it does a number of things. It shifts the weight onto the front of the joints, and those joints can't handle it too long. So that actually attracts calcium to the outside. It also limits the motion of the disc, so the disc can't suck fluid in there anymore, and it can't stay cushy anymore. So that starts to dry out and degenerate. Then, if there's any other kind of trauma, it can actually crack those discs and cause bulges and herniations. It can cause the spine to wear away up to 7 to 10 times faster, according to research. And therefore, even when children are having misalignments due to either tech neck or other issues, it can start that process already. So it causes those bones to wear away, but more importantly, it can cause inflammation that causes nerve pressure and dysfunction and disease to the body. So what's really important is to figure out exactly what the joint mechanics look like, and the only way to see that is by taking motion study x-rays. So one of the things that we do is we see exactly which joints are moving and which joints aren't moving by putting the spine through different ranges of motion to see if the arthritic process has begun. Even if you can't see it yet in terms of the disc damage, we know that it started if the mechanics aren't proper. So another thing that happens when the joint is stuck is that those muscles around it, think of it like a pulley. When the joint is stuck, the muscles have to work a lot harder. And when those muscles work harder, they can then start to pull and tear themselves. And when they heal with scar tissue, and which are never as strong, and then re-injure, which can cause a lot of inflammation and a lot of pain. So what osteoarthritis actually means, osteo means bone in Latin, and itis means inflammation. So osteoarthritis literally means bone inflammation. And what we find is this inflammation and pain, known as arthritis, is because of damage that's going on around the bones. And this type of damage isn't always even visible on an MRI or an X-ray until it's more advanced. And once it shows up on those scans, we also normally see damage to the bones on either side of the disc. While people oftentimes either ignore it until it's too late or they start to take non-steroidal anti-inflammatory drugs, even though it temporarily can help limit the pain of OA, it never fixes the problem. And we also know that the #1 cause of kidney disease in this country and the #2 cause of liver failure after alcoholism is actually NSAIDs, which kill up to 15,000 to 17,000 people a year in the United States alone. So even though it gives you short-term relief, it's never a good long-term solution. So how can a chiropractor, or one like me, help with arthritis? Osteoarthritis causes not only muscle tension, but it also causes breakdown of that disc and nerves we talked about. And prolonged muscle tension and pain eventually cause people to lose their full range of motion. And what we see in our office when osteoarthritis sufferers come in to see us is usually complaints about pain and tightness of their muscles or limited range of motion. So chiropractic care can focus on providing not only relief to those tight muscles and increase the range of motion, but actually get the mechanics of the joints working better. We've seen a lot of our patients get really excellent, not only relief from their pain in a matter of days and weeks, but chiropractic care can actually help prevent further degeneration from happening, because once the degeneration process has begun, it'll continue to progress until something stops it. Whether that is fusion or whether that's a chiropractor. So chiropractic care can help you be more not only comfortable with living with the symptoms, but actually also correct some of that as well. I hope this video was helpful for you. Thanks so much for watching. Make sure you follow us and so you can see more information about us in the future. And I hope to live your best life ever.